name is Linah Kim, and today I'm going to be presenting on the imperative to maintain human rights for mental well-being. Um, Before I begin my presentation, I wanted to take some time to introduce myself. This coming fall, I will be a senior at Robinson Secondary School in Fairfax County, Virginia. As someone who is passionate about a variety of things, I chose to follow a path of student leadership and medicine. I currently serve as president for my school's student ambassador program. I've also had the amazing opportunity of working as a student researcher at NYU's Institute for Excellence in Health Equity, where I'm currently working on a paper revolving around the topic of the current environmental crisis and how that has impacted human mental health. And I've also worked on research at NYU about the topic I'll be presenting on today. I love to play golf, so I'm on my school's varsity golf team, and I also founded a nonprofit dedicated to providing equal access to golf for all junior golfers. Additionally, I work as a chapter leader for Health for Humanity, where I raise awareness for cardiovascular health. In the future, I hope to pursue cardiothoracic surgery. So the purpose of today's presentation will be to demonstrate the inevitable correlation between the legal ratification of human rights treaties issued by the United Nations and mental well-being. So essentially, I will be investigating how these two aspects of society are dependent on each other and how it impacts our communities when one or the other are not upheld. So to start off my presentation, here are three fundamental questions that will not only guide my research I'll be presenting, but will hopefully be answered throughout the entirety of my presentation. So first one reads, why is maintaining human rights beneficial to mental well-being in impoverished environments? How are mental health strategies dependent on the strength and resilience of health programming? And how does the vulnerability of a nation fluctuate based on its incentive to implement core international human rights instruments? So firstly, let's talk about the larger scope of mental health. Mental health has always been an extreme area of concern for many health professionals, but since the COVID-19 pandemic, mental health has taken a serious toll on many people around the world today. So to put this in perspective, around 1 in 5 of American adults experience mental illness each year, while 1 in 6 American children and adolescents experience a mental health disorder each year. And that's just one country. So we can imagine how that is on a global scale. Suicide is the second leading cause of death, and all to say, mental health degradation has heavily impacted mortality rates across the globe. So how do professionals know, and how do they portray whether or not a country is in a state of mental well-being? How can they have an accurate representation of the current social state of a country? So that is when the Multidimensional Vulnerability Index comes in, or the MVI. So the MVI is the UN's way of measuring a country's overall vulnerability to multi-level stressors, and this is reflective of how socioeconomically stable a country is when adversities occur. It assesses poverty across different dimensions like health, education, and living standards, providing a more comprehensive view of poverty than traditional income-based measures. So this is relevant because when human rights are not protected, so things like health, education, and living standards, it takes a significant toll on how those impacted react and eventually the trauma that degrades mental health as a whole. So to model this correlation, I'm going to be showcasing 4 human rights treaties along with 4 low-income countries and trying to investigate the MVI of those countries and whether or not they have implemented the treaties I've chosen. Also the impact of that. So the first treaty is the International Convention on the Elimination of All Forms of Racial Discrimination, which was ratified to provide regulation for state parties to avert racist assault. It states that state parties shall promote understanding among all racial communities. The second treaty is the Convention on the Elimination of All Forms of Discrimination Against Women, which establishes an international Bill of Rights for women, and it has been transparent in bringing in advocacy in areas where women are declined equal opportunities with men. The third treaty is the Convention on the Rights of the Child, which works to provide all children of any race, gender, language, religions, and political stance the right of fundamental human rights. So the fourth and final treaty is the International Convention on the Protection of the Rights of All Migrant Workers and members of their families, which establishes a guideline of fundamental protections migrant workers and their families are granted in order to advance the migration phenomenon. Okay, so for my four low-income countries, although low income doesn't exactly indicate poverty, it may indicate lower quality standard of living, which can increase the risk of poverty. So for my four countries, I chose Somalia, the Democratic Republic of Congo, Togo, and Madagascar. So Somalia has an MBI of 67.31, and they have ratified 2 out of 4 of the treaties. Democratic Republic of Congo has a MBI of 54.55, and they have ratified 3 out of 4 of the treaties. The Togo MBI is 44.11, and Madagascar's MBI is 49.6, and both of which have ratified all 4 treaties. So to put this into perspective, I have a graph that has structural vulnerability on the y-axis and the lack of structural resilience on the x-axis. We can notice that there is a positive correlation between the two variables. We notice that Togo and Madagascar, the countries that have lower MVIs, have a lower structural vulnerability and also have higher structural resilience compared to the other 2 countries with higher MVIs. So essentially, this indicates that as a country has a lower MVI, they will have more structural resilience and be less vulnerable to structural and multi-level stressors. So the countries with a low MBI recognize the imperative to maintain fundamental human rights in the face of multidimensional poverty. By ratifying these treaties and protecting human rights, this leads to more quality services like healthcare, education, and justice, which can improve overall mental well-being and a good mental state of mind. Overall, it promotes social stability and resilience in the long term. So, mental health strategies. By protecting human rights and implementing the necessary treaties to do so, countries are able to protect their citizens and their mental health. Multidimensional poverty further compromises the mental well-being of communities impacted by these exposures, and implementation of human rights to mitigate multidimensional poverty may alleviate mental health stressors. So, to kind of visualize it, think of it like a domino effect. The more treaties that are implemented regarding human rights, the lower MPI a country will have because human rights are protected, meaning that those citizens are less vulnerable to structural destruction. A lower MBI may help reduce socioeconomic stressors, helping ease mental distress overall. So that's how the two are intertwined with each other. So here are my references and my acknowledgements. Thank you to Manasi Kumar and Alani Jack. Thank you so much for watching my presentation. This is my email up on the screen, and thank you.